Welcome to Module 5. In this section, we're going to focus specifically on HIV transmission. This is one of the most important topics in the course because misunderstandings about transmission continue to create fear and stigma and discrimination and confusion. A lot of people still believe HIV can spread through casual contact or touching or sharing food or just simply being near somebody who is HIV positive. And these misconceptions are not only inaccurate, but they're also creating shame and social isolation for people living with HIV. And as counselors, it's important that we understand what actually transmits HIV, what doesn't transmit HIV, and we need to understand how to communicate this information calmly and accurately. Clients have come from environments where sexual health was never openly discussed. Others may have learned misinformation from peers or media or family members or the internet or wherever they've learned it from. And some people may even avoid testing or healthcare entirely because they're afraid of what they believe HIV means. And so this module is designed to give you practical, factual knowledge that supports ethical counseling practice and stigma reduction. We're going to talk about bodily fluids associated with HIV transmission. We're also going to talk about the situations that carry actual risk and what does not transmit HIV, and how counselors can respond to client questions professionally. Remember, your role is not to diagnose or provide medical treatment. Your role is to educate appropriately, to reduce misinformation, and to encourage safety and make referrals when and where needed. And one of the most important things that counselors should understand is that HIV is not spread casually or easily. Transmission requires very specific conditions. So for transmission to occur, the virus has to be present in a sufficient quantity. It has to be carried through certain bodily fluids. And it has to enter another person's bloodstream or mucous membranes in a way that allows infection to happen. And this is really important because a lot of people have fears about HIV that are based on misunderstanding how the transmission actually works. And unlike illnesses like the flu or the common cold, HIV is not airborne. So it doesn't spread through coughing or sneezing or being in the same room with someone. And the virus is also fragile outside of the human body. HIV does not survive well on surfaces or in open air environments. And counselors may encounter clients who believe that they're at risk because of situations that realistically carry little or very little or no risk. And part of the counselor's role is helping clients distinguish between what are these far-based assumptions and the actual transmission risks. And understanding the science behind the transmission is also going to reduce anxiety and panic in professional settings. So, for example, a lot of counselors worry excessively about accidental casual contact with clients. And proper education is going to help reduce unnecessary fear while still emphasizing appropriate safety precautions. So we know that HIV transmission is associated with specific bodily fluids. And the primary fluids capable of transmitting HIV are going to be blood, semen, vaginal fluids, rectal fluids, and breast milk. And these fluids can contain significant amounts of the virus to create transmission risk under certain conditions. So blood, that generally carries the highest concentration of the virus. That's why sharing needles or injection equipment can significantly increase transmission risk. But it's important to note that not all bodily fluids carry the same level of risk. Some fluids may contain extremely low or insignificant amounts of the virus and are not considered major transmission routes in normal circumstances. So understanding which fluids actually carry transmission risk helps counselors avoid overreacting to situations that are not medically significant, while also taking appropriate precautions in legitimate exposure situations. And so the clients may also misunderstand what exposure means. Exposure doesn't just simply mean contact with a person living with HIV. Actual transmission risk depends on the type of fluid involved and the nature of the contact. So for transmission to occur, HIV has to enter the body in a way that is allowing the virus to access the bloodstream or a vulnerable tissue. So that happens through mucous membranes or direct injection into the bloodstream, or contact with open wounds or sores, or the mucous membranes. They're found in areas like the mouth, the rectum, the vagina, and the genitals. These areas are a little bit more vulnerable just than intact skin. And one important point that counselors should remember is that intact skin serves as a strong protective barrier. Simply touching someone, being near them, having casual contact, that does not transmit HIV. Sexual activity can create transmission risk because the mucous membranes may be exposed to infected fluids. Injection drug use carries significant risk because contaminated needles can introduce infected blood directly into the bloodstream. And clients can sometimes assume transmission occurs instantly or automatically after exposure, but in reality, transmission risk is going to vary depending on the type of exposure, the viral load that the person had, the presence of any sores or injuries, and just other health factors. And the counselors don't need to provide complex medical explanations, but understanding these basics is going to help promote accurate education. So, sexual contact is one of the primary routes of HIV transmission worldwide, and transmission risk increases when protective barriers such as condoms are not used, especially when other factors are present. Certain sexual activities can carry higher transmission risk than others due to increased likelihood of tissue injury or fluid exposure. And the presence of sexually transmitted infections can also increase vulnerability because inflammation, sores, or irritation, they make transmission a little bit easier. And substance use can also significantly affect sexual decision making. And so if you're under the influence of alcohol or drugs, you might engage in impulsive behavior or have impaired judgment or just forget to wear protection. Or maybe you participate in higher risk activities that you normally would avoid. And as counselors working in addiction treatment settings, we need to understand the strong overlap between the substance use and the sexual risk behaviors. But it's important to discuss these topics without shame-based language or moral judgment. Fear and embarrassment often prevent clients from asking questions openly about their sexual health. And so professional, calm conversations reduce stigma and increase safety. Injection drug use is another major route of HIV transmission. A lot of people understand the dangers of sharing needles, but few realize that other injection equipment can also create risk. So this could be like the syringes or the cookers or the cotton filters or the rinse water. And other preparation tools could be contaminated with blood. Even tiny amounts of blood can potentially transmit infection under the right conditions. And clients struggling with addiction may share equipment due to withdrawal or desperation. They just don't have sterile supplies. Maybe they're homeless or they fear law enforcement or they have chaotic living environments. Understanding these realities is going to help us as counselors respond with empathy rather than just simply assuming. And harm reduction approaches aim to reduce transmission risk while encouraging safer behaviors and treatment engagement. So counselors may personally have strong opinions about substance use, but effective counseling is going to require separating personal beliefs from evidence-based care. Now, let's discuss what does not transmit HIV, because that's where the fear and the misinformation become most harmful. It's not spread through hugging or shaking hands or sharing the bathroom with someone or sharing food or touching surfaces or just casual social contact or sitting near somebody. And it's also not spread through mosquito bites. This misconception caused significant panic during the early years of the epidemic, and it still appears occasionally today. Saliva alone is not considered a common transmission route in normal daily interactions. I think you'd have to drink like a gallon of saliva in order to get HIV from it. And understanding these facts is essential in reducing stigma. And people living with HIV have historically experienced unnecessary isolation because other people fear that casual transmission. And counselors need to avoid reinforcing that fear-based behavior or language. And then at the same time, Counselors also need to continue following universal precautions when exposed to blood or bodily fluids, if at all possible. Appropriate safety practices are about professionalism and consistency, not fear. And transmission risk is also influenced by viral load. So a higher viral load generally means more virus is present in the bloodstream, which then increases the transmission risk. And effective HIV treatment can reduce viral load dramatically. When a person maintains an undetectable viral load through consistent treatment, sexual transmission risk becomes effectively eliminated, according to the scientific research that we understand about this. So this concept is known as undetectable equals untransmittable, or U equals U. If it's undetectable, you're not going to transmit it. And that's been one of the most important advances in HIV prevention and stigma reduction. But not everybody has equal access to consistent healthcare or medication. There's barriers like addiction or mental illness, or maybe they don't have stable housing or transportation. They have financial limitations, and then like the stigma out there. And that all affects the treatment adherence. And so counselors, we need to support our clients by encouraging healthcare engagement and helping reduce behavioral barriers to the client getting treatment. And then there's fear around HIV, and that often affects behavior more than just the facts alone. And the clients may even avoid getting tested because they're scared of rejection or judgment. They may think that there's going to be some relationship consequences if they go get tested, or a social stigma. And other people avoid discussing their sexual behaviors or their substance use honestly because they're ashamed. And they start to get defensive and dismissive about it, or they get resistant when HIV-related topics are discussed. And so we need to recognize that these reactions are often rooted in fear rather than defiance. Creating an emotionally safe counseling environment increases the likelihood of honest conversations and healthy decision-making. The goal is not to scare clients into compliance. Fear-based approaches often are going to increase avoidance. So the goal is to promote informed, respectful, and non-judgmental conversations about health and safety. And counselors are going to play an important role in HIV education, but it's important to stay within the scope of practice. Your responsibilities are going to include correcting any misinformation, discussing risk behaviors, encouraging them getting tested, supporting any prevention efforts that they make, and then also, of course, providing referrals. Our role is not to diagnose HIV, and we're definitely not providing medical treatment recommendations, but we do need to remain aware of personal biases or discomfort related to sexuality or substance use or HIV itself. Clients are often sensitive to tone or body language and judgment, and simple professionalism and respectful communication can significantly reduce the stigma and improve the client trust. So as we close this module, I want you to remember that HIV transmission requires specific conditions, and it doesn't occur through casual everyday contact. Understanding transmission accurately is going to help counselors reduce stigma and correct any misinformation. We're going to promote safety. We're going to support healthier client decision-making. So in the next module, we're going to take a deeper look at injection drug use and HIV risk, including the realities that our clients face, and harm reduction strategies, and what's the connection between addiction and transmission vulnerability. So when you're ready, proceed to Module 6.